My name is Matt Dixon and I'm the Director of First Nations Health and COVID-19 at Western Victoria Primary Health Network. I'm your facilitator for this session and I'm joining you from Gadabanud country. So welcome to the final primary care stream session for today. The next session at 1:10 will bring the GP stream and the primary care streams together for a plenary session on First Nations Health, the role of primary care. But right now we're going to discuss how to refocus on your business with Kim Poyner and Rivka Hagen. Please take a note of the health pathways slide on your screen. There it is. That's also available in your handout section if you want to refer to that later. So I'm now going to introduce Rivka and Kim. So starting with Rivka, starting her professional career as a medical scientist, Rivka Hagen successfully implemented and managed a regional laboratory of a major pathology provider before embarking on a career of medical practice management and general practice accreditation. She has managed small, medium and large medical centres and has a strong interest in leadership development and coaching, quality improvement, governance, business planning and financial management. Rivka is the Director of Medical Business Services, providing consulting, advisory, coaching, training and mentoring services to the health sector Australia-wide, including general practices and primary health networks. She is also an experienced board director in the health sector. You may also know Rivka as the founder and administrator of the highly active and influential Facebook group Practice Managers Network, which now has a global membership of over 8,000. Welcome, Rivka. Kim Poyner has an extensive history working with medical centres and primary health networks to train medical professionals in behaviour change theory and chronic disease management. In 2015, she was awarded the Australian Best Practice Nurse Award in Chronic Disease Management. Kim is accredited with the National Board of Health and Wellness Coaches as a health coach and has executive coaching endorsement through the International Coaching Federation. She's currently training health professionals across Australia in the healthcare home trial, readiness projects and quality improvement strategies. Kim regularly presents at national conferences as a keynote speaker on change management, coaching, chronic disease management, creating efficiency in general practice and care coordination. Through her business MediCoach, Kim mentors nurses and organisations to achieve their best, ensuring that they are resilient in the changing health landscape. And isn't it changing? She is currently a director of the Australasian Society of Lifestyle Medicine and the Practice Excellence Institute. So this is going to be run as a bit of a conversation between Kim and Rivka, and then I'll jump in with questions that are coming up in the chat as they pop up, and it'll be a interesting dynamic discussion. So over to you, Rivka and Kim. Welcome.
Thank you so much, Matt. It's really wonderful to be here, and a very hearty Sunday welcome to the audience. We just heard that the attendance is really quite stellar for these sessions, and that's awesome. So I guess before we kick off, I would like to acknowledge the traditional custodians of the lands on which we are all virtually meeting today and pay my respects to elders past, present and emerging. And I'm currently on Dja Wurrung country in central Victoria. So hearty welcome. Hi to you, Kim.
Hi there, and hearty welcome from Biripi country up in Port Macquarie. So it's fabulous to be here virtually meeting with you all today. And as Matt highlighted, what a changing landscape we've got. And Rivka and I are talking about how do we refocus in amongst all this change that's going on. So that's where we're headed today, Rivka.
Yeah, absolutely. So we have been given the remit by West Vic PHN with a couple of very specific areas that they would like us to have a bit of a chit chat about today. And they are in relation to quality improvement and a little bit about routine screening and getting your reviews back up and running again in this just very, very tricky landscape that we find ourselves in at the moment. They've also asked us to talk a little bit about staff retention and performance management and review, as well as staff education. So there's a bit of a grab bag there, and that's very much the reason why Kim and I decided that we would ditch the slides and just simply have a bit of a conversation to tap in to the common themes that we're hearing about and that we're sort of intersecting with at this point in time. So gosh almighty, Kim, we were presuming that by now we might be sort of heading towards the tail end of pandemic and sort of resetting to a new, business as usual space, and it just really doesn't feel like it at all, does it?
I feel like, Rivka, that this is going to be the business as usual moving forward, that we need to plan for the unplanned always, right? And I think particularly when we're thinking about quality improvement, if we start there potentially and think about we've changed and adapted and changed and adapted and changed and adapted over the last few years, there's no doubt about it. But absolutely, can we start with an appreciative progress on how much you guys have adapted and what you've achieved in that time? So hats off to you all. In terms of moving forward, I think, when we keep looking at quality improvement and thinking about what do we need to do to adapt, right? But not only that, how do we make informed and strategic decisions at a bite-sized piece in amongst all of the, as we say, plan for the unplanned, that's going to be the normal. How do we start to get these things so we feel like we've got a sense of control and we feel like we can really drive this primary care ship again?
I'm glad you said ship. Yeah, look, exactly. It is about that sort of that resetting of expectation and being very aware of what the limits of your resourcing look like. And again, that's a real moving feast, isn't it? With a lot of staff absences that we're experiencing at the moment, and a public that is perhaps not as kind to us and our staff as what we would like them to be, that we really do need to dig deep and be very clear and intentional about the systems that we put in place to help us with some of these themes that we're going to be talking about this morning. And so I know that we had a little conversation about this in a different forum just the other day around some of the organizational hygiene systems and processes that need to be put in place so that there is a capacity to just refocus on some of this structural work that needs to be undertaken. And all of those topics that we are talking about today really fall within that remit, don't they? So I guess, what comes to mind for me is about creating space and time blocks where we can actually deeply focus on some of these themes and areas that we need to attend to if we're going to remain successful and remain resilient down the track. And that might be things like closing a door and saying, my open door policy actually has some boundaries around it so that I can sit down and do some planning and some deeper work in order to put the systems and processes in place for these themes. What are your thoughts around that, Kim?
Yeah, I think there's always been a need and a desirability about protected time. And I think everyone needs to understand that every time we are distracted or, someone else is trying to capture our attention when we are trying to do that deeper thinking, you're actually decreasing your productivity across the course of the day. So there's absolutely a need and a desirability to that, as well as team meetings to keep everyone up to date with, we've seen a lot of huddling throughout the pandemic, haven't we, of people trying to keep everyone up to speed with this change that's been going on. So absolutely having that deeper time to think about what it is that you need to put in place, because we saw the practices that held really solid throughout the pandemic. They did have those strong foundational things in place, right? They had the data cleansing going on. They made sure that they had systemized approaches to things rather than just sort of throwing whatever they had at it as a reactivity model.
Yeah, look, they're great strategies, and certainly time blocking and being very intentional about the body of work that's ahead of you and mapping that out. And I think sort of a month at a time is a really good time to look at some of these sort of bigger picture systems and processes that require your attention, and they are the times that you might want to put into calendars and block off, close your door, maybe even use those times as working from home opportunities to really be able to get some of that solid work done. So those are just some of those top level ideas around, well, how do we make all of this stuff happen when we are just busy. But let's jump in and have a closer look at the space of quality improvement. What have you got to put onto the table in terms of getting all of that back up and running? Where are we at? Where should we be focusing our attention there?
Yeah, well, on my top tier level in my organisation's health strategy, and I'm obviously in the quality improvement space in a number of PHNs and catchments. And one of the main things that trips practices over is not getting routinely in that systemised approach of deactivating clients, just something simple like that, to really be able to then understand their data, understand what's coming through their door, making sure that we're cleansing out things, because you may have been a COVID clinic for a while, and deactivating those people is really important activities. So then you can look and see, how are we going in terms of, maybe your PHN is providing you back some reports on your quality improvement measures, or how are we going with our PDSA activities? Are we making sure that we're looking at, killing a few birds with one stone, so to speak, with one PDSA? We're looking at our accreditation activities, we're looking at how we can improve our business model, and we're also looking at how can we provide better quality outcomes for our patients. All of those things. You might be involved in projects as well. There might be cancer and the like across your catchment that you think, I might do one PDSA that's going to tick off all those boxes. So again, just having, less workload, right, by less duplication and replication, and having a clean slate to really analyse your data.
Yeah, this is what we still see a fair bit of, isn't it, Kim, that practices are considering these bodies of activities in isolation at times, rather than seeing the overlap between different programs and systems and policies and work to be done, and perhaps then ending up with duplicating work, or not really sort of finding the gold in the activities that they're doing. So it's around thinking, what, first and foremost, of course, where are we going to get the most bang for buck for patient outcomes? I think if you start with that as your primary aim, then the activities you're going to undertake are going to manage and improve your business functions. It's going to meet the needs of your accreditation requirements in terms of tracking your quality improvement activities. And remember, for accreditation, that's very much focused around clinical quality improvement, rather than necessarily other quality improvement within your business, even though that's really important too. And then capturing that in a way that meets the needs for both. So it meets the needs of the QI PIP program, the Practice Incentives program, and have it ready as your evidence for accreditation when that inevitably comes knocking on your door, which we know is happening a lot more now too, after the hiatus with the COVID-19 situation. So systemizing it and having just a single approach to covering all of those areas off. And I thought it would be probably a good idea too to just sort of run through the 10 key measures that practices are having to report to. And remember, most of this is happening automatically through your data extraction through PenCat and the like, where the data that you're supplying to your PHN is actually going into that national data set. Remember, there's 10 measures there, so we'll very quickly run through them. So the very first one is the proportion of patients with diabetes who have a current hemoglobin A1C reading. Number 2 is the proportion of patients that have a smoking status recorded. Number 3 is the proportion of patients that have weight recorded. And number 4 is the proportion of over 65-year-old patients that have a current flu vaccination. So, of course, this is very topical at this point in time. And influenza vaccination actually runs through the next 2 measures as well. So it's diabetes patients with flu vaccination, as well as COPD, chronic obstructive pulmonary disease patients with influenza vaccination as well. Then there is the proportion of patients that have alcohol status recorded. Number 8 is the risk factors that enable a cardiovascular risk assessment to be undertaken. Number 9 is the proportion of females with a current cervical screening performed. And the last one is the proportion of diabetic patients that have a current blood pressure recorded. So you can see there's a bit of a grab bag of sort of aged care, influenza vaccination, health and lifestyle management, cardiovascular disease management, and the like. But none of those 10 are sort of really revolutionary. This is all part of business as usual. So if you're struggling to think about, well, gosh, where are we going to focus our PDSAs for improvement? They are your markers, aren't they? That would be the very first port of call to use your data and see how you can respond to those. What are your thoughts, Kim?
Well, what screams out to me is probably our next topic, which is that routine screening and reviews. So again, getting these into a systemised way. And I know particularly some of the practices that I've worked with, they've bundled those activities together and said, okay, well, when we've got flu vax, we're going to make sure that we're really making sure that those targets are met in terms of influenza and pneumococcal, right? And we're going to make sure that at the start of the season, after New Year's Eve resolutions, we're going to focus in on those lifestyle things, right? Increasing recordedness, making sure that we're looking at our data again to make sure those topics are covered off. And where do I see those activities being really streamlined? Chronic disease management, there's no doubt about it, having a look at the prevention and screening activities and making sure, your reminders are put in place so that people are making sure that they ask the question. And if we ask the question routinely and it becomes just part of the process, then patients aren't thinking, why is she targeting me with this, smoking question or weight question or alcohol, the sensitive questions that clients might go, well, I don't really like talking about them. And people often say to me as health professionals, I don't really like talking about those things because what if I open up a can of worms? If we put it in part of our process, like the RACGP clinical guidelines where we cover off the SNAP, the smoking, nutrition, alcohol and physical activity, we're starting to capture some of that stuff that you just ran through, REFOCUS. So I'm seeing health assessments, 40 to 49, 45 to 49, heart health checks, chronic disease management, item numbers like your 10997s, your 10987s to really assist you there. And we know the Medicare Task Force review, let's go pre-pandemic when they were
Getting a little glitch here, but it usually sorts itself out quickly.
We've got a sorry, Kim, your internet looked like it just froze there for a sec. So if you want to maybe just backtrack about 10 seconds, that'd be great.
All right. So did you hear about health assessments and then the like, making sure we look at
that's where it kicked off from.
Okay. And making sure we use the 10997s, the 10987s to embed the care. And we talked about pre-pandemic about the Medicare Task Force review saying routine care is where the patient outcomes occur, not just creating a care plan once a year, making sure that we really engage our audience into these activities and think about how can you spread those great activities like ECGs and Dopplers, sick day action plans and the like, so that we're getting people doing cancer screening. And Rivka, we were having a conversation, weren't we, a couple of days ago about Spiro?
Yeah. Yes, exactly. Well, of course, the trickiness around spirometries and supporting, some of that that screening activity too is pretty fraught at the moment. We do know that spirometry is really quite tricky as we just are in such a heightened state of both COVID and influenza and other respiratory illnesses as well, that we do sort of caution practices to just go easy in re-establishing spirometry services and really assessing the the ultimate need and really doing that risk assessment to ensure that there is a really good imperative for doing those, and perhaps thinking about leaving those off for the time being too. But Kim, I was just reading earlier this morning again just that reiteration that we're sort of on this cliff of undiagnosed serious illness on account of lower screening activities during the last couple of years of pandemic, that is really at our doorstep. And so it is really important for practices to start engaging well with those screening activities, to really start picking up on that sort of undiagnosed cohort as well. So the other things that we're thinking about there are, the bowel screen, and of course, patients are sent those kits automatically, but just being very aware of those happening. Also breast screen, making sure that, those referrals are still happening. Cervical screening, again, that's now reduced down a bit from the program that it used to be, but don't forget about those. They seem to sort of be a little bit flying under the radar at the moment, and they're super important. And, the one that really excites me, of course, is the heart health checks. And the Heart Foundation has some fantastic tools to help out with establishing some routines and templates and systems and processes around heart health checks as well. And I do want to say too that Kim and I have drawn together a bit of a list of resources which is available in this session too. So some of these resources that we're talking about, you'll be able to find the URLs directly in that PDF document that we're making available. We're also really encouraging the audience to please submit your questions. Just come and let us know what you would like to know from us, and we will absolutely endeavour to get to your questions throughout this session as well. So, Kim, was there anything else that we have omitted at this stage as far as routine screening and reviews are concerned?
You betcha. It's about where do we optimise our team? So who does which bits within their scope of practice, and how can we make sure someone's not feeling like they're doing everything? Because that's never effective for any organisation. And, if we talk about staff retention, we want to make sure that we're not burning people out. And there is this sense, isn't there, if that people are just exhausted. They're exhausted and taking on more and more load. So when we heard that there was good attendance today, we were quite excited about that, because there has just been one thing after another, after another, after another with primary care. So again, just, a massive credit to you for showing up today and really giving yourself the time for patient education and also your own CPD training and education as well on just what areas might you be able to do and feel like you've got some sense of control back in terms of this uncertain times, which is always going to be, as we said, moving forward. But I think, when we look at starting to think about teams and scope of practice, think about, how can you utilise everyone, or what ways can you use software and the like? And we know that you've had Chris speaking earlier on from Cubico looking at your CDM process, but there's plenty of other things that you can utilise when, you think, I haven't got human power. Do you have other ways of engaging with software as a solution for you in a variety of ways? It could be even a communication tool. And, performance reviews, Riff, we'll hand over to you for your thoughts and tips and tricks on that.
Yeah, look, absolutely. I guess before we sort of do a slightly more deep dive into the performance review area too, I've sort of thought a little bit more too around, what are we seeing in terms of the staffing movements? It does feel just so very fraught, right? So I tried to draw together some common themes of what we are hearing out, not just in the healthcare sector, but it is more global than that. Why are people moving away from their roles? Why are we just finding it so very difficult to attract staff into our organisations? And we're going to leave the GP recruitment bit a little bit to the side. That's probably a topic for a whole other session. But some of the common reasons that we know that staff are looking to move away from your organisation include things like the remuneration and the salary rate. So payment of wages is a big factor in this, and we know that award rates are just really not hitting the mark in terms of people's expectations and readiness to do deep and difficult work, for award rates. The awards are fairly ungenerous, so you really need to think about your practice's capacity to step up with that and really pay fairly and reasonably in order to help with that retention. Also, often staff are feeling overworked and unsupported. And I think that's a really big key to this space as well. There is also the bit about career advancement. So staff who feel that they've kind of reached the limits of their capability within an organisation are often going to be looking elsewhere to spread their wings a little bit further, and those opportunities are far and wide now. So that's yet another challenge. Work-life balance, we can certainly all relate to that everyone is just needing a bit more time to regroup and cope and rebuild the resilience and fill that cup up to be able to continue doing that hard work. And probably a key one for me is a lack of recognition. So this comes down to sort of the systems and the cultures within workplaces that just don't really provide authentic and heard appreciation for what's happening around them. So think about how that might play into your workplace, or could that be a point of difference for your organisation to be doing better? So a few other areas there are boredom. So staff who are not feeling challenged by the work they're doing are likely to move on. Dissatisfaction with management is another common reason for leaving an organisation. The company direction or viability, if there is a risk there, that can make it a little bit fraught. Just simply a desirability for change, that can be enough to make people look more broadly at what their options might be. And if other opportunities come up from elsewhere that come knocking on their door, that's likely to play out as well. So that's just kind of painting that picture around why are people leaving? They're just not hanging around. And so I think from there, we really need to look at some of those strategies for how do we actually keep people within our organisation. So it's really addressing so many of those areas that are making people leave. So it does start with onboarding and orientation, doesn't it? And we're going to certainly talk about how we do that and how we manage our staff performance, fair reward for recognition, and those systems for really recognising that. Mentorship and support is very important for making people feel supported in the workplace. Remuneration, of course, as I've already mentioned. Wellness offers. So again, this is just, what is your organisation doing to really put that thanks and gratitude towards staff for the work that they are doing, and how meaningful are the programs that you're putting in place. Communication and recognition, and we'll certainly talk a little bit further about that. And then we are really starting to talk about performance management, feedback, training and development, and workplace flexibility. So there's a lot of dot points in that in terms of how organisations can sort of repivot and look at their systems and processes for supporting their people in order to make that workplace hum. And I know humming workplaces are something that you're really passionate about too, Kim. What can you tell us about that?
Yeah, I think that they're all very important tips. And what I would add to them is understanding, like particularly on that welfare perspective, what does change fatigue look like? Right, and really identifying that within your staff, because that's no doubt a reality of what probably a lot of staff are feeling like. And if you're thinking we're trying to make all these changes and we just feel like this person in our organisation is pushing back, and you think there's a bit of resistance there, it's really important, as Rivka said, to have that leadership scope within your organisation, particularly at that executive level, to go, hang on a second, let's unpack it and see the root cause analysis of that. Is that coming because this person is overwhelmed and exhausted? Or is this coming from a place of they just like things just the way they were? Right? And both things can be remedied. There's no doubt about it. But it's, again, identifying what tools and strategies you need to use as a leadership model to start to unpack that and remedy that throughout your organisation. Or else people, once they get to that change fatigue point, if it's not being addressed, absolutely they're going to burn out and leave. And that's the last thing we want. We want to make sure that we've got the best as we possibly can, our health and well-being of our health professionals at our utmost of our highest regard, and really making sure that we keep them thriving in this space, because no doubt there's a need for health and well-being checks within all of us at this point in time. What can I do? The little things at home, or the little things that I can do to make sure that I can show up the best I possibly can. So I'm a lot more, resilient when there are uncertain times. And I feel like there's a platform and a forum where I can discuss these things as well, that I can say, hey, I'm just not coping at the moment, or I'm feeling like we're changing things in a way that is just not going to be of benefit to the patients and the like. So they're the bits that we're talking about here, aren't we, Rivka, in terms of having that communication pathway open?
Yeah, absolutely. And that communication needs to be broad, it needs to be deep, and it needs to be wide. It really needs to overlay every area of operations within, within a practice. And at this point in time, I guess, when everyone is feeling so stretched and so stressed, you kind of need to go into communication overdrive, don't you? So if the communication starts to feel like it's too much, it's probably just enough. Would that be your sense too, Kim, that, that intentionality around how we communicate with each other, and multimodalities to ensure our messages are heard and understood, and we are receiving that feedback too? What are your thoughts around that?
Yeah, and that's where I come back to software again, using, your project management tools and software that will enable you to keep people up to date, particularly people who might be working from home. They may be doing your telehealth components and the like, but how do we keep them feeling like they're still part of that team and still, a vital part of the organisation? They're not isolated and removed and don't know what's going on and feel like they're out of the loop. Right, that starts to create a little bit of that resistance, as I said, and a bit of discord within our team, and that's the last thing we want to foster. So, are emails not being read and people are, got copious amounts of emails? Start to think about how might you do things differently, and that's part of that onboarding and induction process of finding out how do we communicate and what's vital, what are the must reads, right? What are the things that can be left aside? But we need everyone to be singing from the same songbook. So we all need to be on the same page when we're addressing, how we might workflow our day-to-day, how we're addressing reminders and recalls, and how do we, get people on board with thinking about changing and doing PDSA activities. Because, you often hear people say, I've got this really great idea and I want everyone to be excited and enthused about it. But we need, from their perspective, what they hope to gain or what they hope to feel, or how it's going to make a difference for them to buy in and be motivated and enthused to join the initiative.
Yeah, exactly. And I guess too, look, I think we might just pause it there for a moment. I think there may be a question from Matt. Hi, Matt.
Hi there. Thank you very much. I'm learning a lot, and it's given me so much food for thought. I'm really grateful. But I just wanted to jump in and just reflect on something and see what you think about what's in my mind. And I'm thinking about the pandemic, a feeling that, what I was observing very much third hand, because I don't have sort of that direct clinician interface at the PHN. I'm sort of removed from that, but certainly, I was very much talking with my colleagues who do have that, because I sort of coordinate the COVID-19 response and sort of oversee all of that. And I reflect that earlier on in the pandemic, say even a year ago, we were aware that there was, great stress, burden, burnout, distress amongst practice staff, and that was being reported through our, fantastic practice facilitators quite a bit. And then generally in the broader, the media, the community knew that, general practice was struggling under the burden of responding to the pandemic. And I know that we offered EAP for practices and opened that up for, practice managers, I think practice nurses, probably maybe not so much practice nurses, because I think they have access to that through other means, through professional associations, as do GPs, but certainly reception staff and practice managers. And, I think the uptake of that was, perhaps not what we might have sort of hoped it would be. And I think our sort of assessment of that was that people are so stretched and stressed that they can't even put their head above the parapet to take time out or even think about taking time out for that self-care, which is not a sustainable approach, but that's where people find themselves when, they're in that sort of situation. And I wonder, I'm interested in your thoughts about, now that this pandemic isn't just going away as sort of we probably all hoped, even if, our knowledge and the evidence showed that it probably wasn't going to happen, on an emotional level. I think people were hanging on, thinking, okay, just a bit longer, hang on, I'll be right, I'll get through this. And it's not going away. And I'm interested in your thoughts about what happens now and what we need to sort of encourage practice managers and staff in practices to think about, because there's only so much, fuel in the tank. And once the tank's empty, the truck's not going anywhere. Thank you.
Yeah, I think it's really important that we think about, not running on adrenaline all the time, right? And thinking, as you said, where's the finish line? Where's the finish line? Is it just here? Is it just within reach? Well, that's not the case, right? So we need to think about, how do we make sure that we're going to be able to keep up whatever pace is required for the duration of our working life. And, how do we make sure that we're balancing all that out with our home lives as well, and everything else that's going on? And that's about your mental health hygiene, and thinking about all of those other life that you can start to fill up your cup. Even thinking about, what are your energy drainers, but what are your energy nourishers? So what gives you energy, and what gives you that life-sustaining capacity to show up in a way that, you're not just going to get through tomorrow. Make sure that you're going to be able to keep this going, right? So what things are they? Are they sleep? Are they looking at nutrition? Are they looking at social connection? Are you making sure that you reach out to support programs that have been offered, like you just mentioned? And not thinking, I haven't got time. And I think that's a common thing, is people could think, I haven't got time for this. But it's what Rivka was saying before, it's a priority that we make time, right? It's a priority that we actually go, this is part of my working life now. And if I don't prioritize it, I'm actually going to burn out and I won't be able to continue on. So I think that's about making it front and center. The first thing I do is I'm going to focus on making sure that I put on some time allocation to look after me so that I can look after others.
Yeah, look, I agree. I would say also, Matt, that the availability of employee assistance programs, the EAP that you were just mentioning, I think it still kind of flies below the radar. And that's because these are not programs that have traditionally been accessed by the likes of practice managers or practice staff. So there's a bit of newness around, what is that? And, how do I intersect with that? So I do think that, PHNs really do have a remit to ensure that there is broad knowledge that these programs are out there to assist practice staff to receive some additional support. And, we know too, through the Practice Managers Network on Facebook, that is the large group that I facilitate. There is a lot of sort of social connection there too, and it is about that shared experience. We do know that, especially practice management, it's a lonely job. There is one practice manager in a clinic, and you're bunny in the middle between the clinical teams, the GPs, and the administrative staff and the nurses, and it is absolutely a high pressure situation. So it can feel very isolating and isolated. So reaching out to your network of people who are experiencing exactly the same thing, that can be quite cathartic to kind of understand that you are absolutely not alone, and that what you're experiencing is not unique. So it's not you, it's what everybody is kind of experiencing, and that sort of group remediation and support can be very helpful in bringing about sort of more common understanding too. But I guess I also want to make sure that we do talk a little bit further. We've got about 10 minutes to go, so I'm mindful of time. Just around the staff performance management framework too. We did sort of reflect on that, Kim, that, that sort of starts with orientation and induction, position descriptions, and really setting the stage for a solid entry into a new organization. And it is that framework that then provides the guide rails for performance management, doesn't it? So if we don't have up-to-date position descriptions, and we get to that situation where we are, undertaking performance management reviews. So we're talking about the more formal, once a year or twice a year events where we sort of sit down a little bit more formally, take a step back and look at the bigger picture of where are we at with our employees? Where are we going to support our employees to take the next step, rather than the day-to-day support and communication and resolution of issues that crop up on a day-to-day basis, which we know need to be handled right there, right then. That is not what performance reviews is about. But when we're talking about the performance reviews, remember too that it is an accreditation requirement, that practices do have some formality around that. But aside from accreditation, these are really great opportunities to take that step back, catch up with your employees, and have a two-way conversation about what's working well for the employee, what their ideas and their wishes and desires are all about, as well as provide more global feedback to staff to say, look, this is what we're observing. Your strengths are in certain areas. We see opportunities for improvement in other areas. Let's map out some training and development opportunities to see staff continually progress. That's really what we're talking about with regard to performance review, isn't it, Kim?
Yeah, and we've spoken with Chris Mead about this topic on a number of occasions, haven't we? When we talk about that, getting that temperature check on how is your staff going, and what are their eyes and ears from their perspective and their lens picking up that's happening in your organisation, and hearing from a lot of different perspectives is a really cool way of getting some innovation even into your practice and starting to think about, hey, we keep tripping over these current issues, and getting different voices and different diverse opinions in there, ideation, right? To start to think about how might we go about getting some good solutions here, right? Rather than just being this thorn in everyone's side that's never addressed. So again, not just relying on the executive team to come up with the solutions always, but really using our tribe, our whole practice tribe, to come up with solutions and ideas. But having those regular temperature checks will keep your eye on, how's my whole team going? Are they okay? Or do we need to actually take some time out and have some additional meetings, or do we need to do some welfare check-ins and the like as well? So to remediate those quite quickly. If your performance reviews are yearly, we might want to be addressing things, as you said, a little bit more. And I think also seizing people's passions. Like REFOCUS said, what ideas and what things do they want to have in CPD, rather than just saying, well, you go off and get your immunisation update every year and your wound care update. Hang on, what about if you've got someone who's really passionate, who really wants to drive CDM? That was me, right? I was like, yeah, I really can see that this is going to be a really great thing that I can sink my teeth in and really drive. And again, that just allows a platform for those sort of discussions to be had for the team, particularly at the executive level, then to go, well, hey, what sort of education would you like over the next 12 months? And let's go and find where those opportunities are.
Yeah, exactly. And look, another tip and hint there in terms of, staff education and development too, is for practices to consider maintaining a staff development matrix. So that's really mapping out who's on your team, what are the skills that are currently within your team, importantly, what are the skills that are missing that you would like to see developed, and who best fits that sort of growth opportunity there as well. So again, using a simple spreadsheet, you can just put, names against, competencies and skill areas, and easily be able to see who's got what and where those gaps are. So a skills matrix can be, a really great way to manage that as well. So again, I guess what we're talking about here is, Kim, simple systems to really allow practices to feel like they've got their finger on the pulse and have direction and purpose in their activities, rather than the free floating and going, oh my gosh, I need to organize staff training because accreditation tells me we need to do staff training. What are we going to get our staff to undertake? Which is just such a reactive way of managing, knowledge building and skill building within an organization. So we're really trying to challenge practices to flip that around from a reactive space to a more proactive space, which will feel a little calmer. It will have more purpose to its intentions, and you're likely to see better outcomes as a result too. So I guess that's probably enough for me. Any final words from you, Kim, before we wrap it up? Gosh, this time has just absolutely flown by. We could chat all afternoon, couldn't we?
So I think my thing particularly is I'm seeing a lot of newbies come into the space, and I always say there's lots of free education out there as well. Just look at the source where you're getting your education, and we've got a PDF that we've got some ideas there, particularly on where you might send your staff. It could be reception staff that you're onboarding, it could be clinical staff. So there is CDM stuff that's available on Services Australia, as well as reception on HPOS and PROTA and the like. And, we've got PenCat recipes that we can reference you guys to. And, there's plenty of things that Rivka made mention of, the Heart Health Toolkit, CVC Toolkit, and the like. So thinking about how can you seize those opportunities. It doesn't have to be a great expense to you. There's already a lot of resources out there, but just people knowing that they can actually start foundational and have confidence to step through things and learn it the correct way, rather than just being quickly inducted and no one's given them even the resources, knowledge of where to find things, where to find the facts.
Yeah, yes, exactly. Gosh, there's been a lot that we've put on the table. So again, just referring everybody to the PDF download that's available as part of this session. We might invite Matt to come back in for any sort of final questions, or just the wrap up, I guess.
Lovely. Thanks, Rivka, and thanks, Kim. One thing I was just reflecting on in that last little bit that you were talking about was that culture in a practice where there's all voices are valued, and all skill sets and experiences, regardless of what position someone might sit in the practice, is so important. I would imagine. I've not worked in a practice. I've been a community health nurse, but never in a primary care GP practice. But I've certainly been to the GP plenty of times in my life, and that'll continue. But I think that idea of what are the pain points, and giving people a chance to say what's bugging them and what's difficult, and sort of starting to address some of those things as possible, but then also that more positive orientation about what are some new ideas. So not just the negative, but a bit of a balance of both. That sounds great. So thank you very much for that presentation and that discussion. So much in there, and I'm really grateful to you. So we now are going to finish this session. And we're going to ask you to take some time to complete the in-session evaluation, which is going to pop up on your screen any moment. And then if you won't be joining us for the plenary session, please complete the post-conference evaluation. That can be found as a link on the homepage, and it's also going to be emailed to you. And we really encourage and ask for those suggestions about how we can plan to make a 2023 refresher that's going to be absolutely wonderful. You'll be getting certificates of attendance emailed to you for each session you attended today. And that's pretty much it. But hopefully we'll see you all at the plenary on First Nations Health, the role of primary care. I know it's going to be an absolute cracker of a session. So hopefully we'll see you at 1:10 p.m. And thank you, Kim. Thank you, Rivka, and all the best.
Thank you so much.
Thank you for having us. Great to be here.
Thanks very much.